about Carter because he, I think even more than my own child, is the reason I'm doing this today. Carter was a very active, hilariously funny 6-year-old. He loved to play soccer. That was his thing, soccer. And when his leg started to hurt, his parents and his doctor thought that he had injured himself playing soccer. But it turned out to be bone cancer. Carter had Ewing sarcoma in his leg. He went through extensive treatment that lasted about a year. Lots of chemotherapy, radiation, and eventually surgery. So his leg was amputated at the knee. 3 weeks, I remember this very vividly. He finished treatment in December one year, and 3 weeks later, they discovered that his cancer had returned to his skull. He had, with Ewing sarcoma and any bone cancer, they have to remove that cancer. So he had a portion of his skull cut out, removed, and they didn't want to reconstruct that, not knowing whether he would survive. They didn't want to put him through that. So he wore this hard, kind of like a hard hat to protect that area of his skull. Carter suffered like nothing I have ever seen. And he died in September of 2004. But what I remember most about him, even though I do remember his suffering, was how he was such a kid. He smiled and he laughed, and he came to love the Food Network. He played Nerf baseball in the hallways of the hospital with his when he felt well enough. And he would get down there on his little stump, and he would hit, and his brother would be his pinch runner, and they would play baseball in the hall. But he really, really suffered. And his suffering and his spirit affected me so much. I keep his picture by my desk every day. And I look at it, and I always want to remember why we're doing what we're doing and why I'm personally doing what I'm doing. One of the important things about Carter's story is that the same day that he was diagnosed with cancer, there was another 6-year-old boy named Will who was also diagnosed with Ewing sarcoma. So it was the same age, two boys, same disease, same day. They were both diagnosed with the same thing. From all prognostic factors, the doctors felt that Will would not fare as well as Carter. They went through the same treatment regimen, except for Carter had his amputation, and Will had a less aggressive surgery called limb salvage. So even though Will's prognosis was less favorable than Carter's, and Will had less aggressive surgery, Will lived and Carter died. And the question is why? What was it genetically that made Carter's cancer resistant to treatment? And I think that is the question that we're trying to answer. If we knew what it was genetically about that tumor, they could have altered the treatment for Carter. And that is what we're trying to do, is find out what it is about these tumors, what genes, what mutations, what pathways are active, so that we can adjust treatment for those who are at the highest risk. So that's one of the questions that our research money is aimed at answering. We're really focused strategically on the 20% of the kids today who are not surviving treatment. The other question deals with the impact of treatment on survivors. And for that, I'm going to share with you my sweet friend Madison, who turned 21 in January. I'm going to pass around 2 pictures of Madison. One is with her and her doctor, Dr. Claire, as she's affectionately known by many of us, and then a picture of her that was just taken last year.
And that's a picture of Carter.
Thank you. 2007, at the age of 15, Madison was diagnosed with a brain tumor. I just want y'all to see her. She's such a beautiful girl. She underwent 30 treatments of carboplatin combined with 30 treatments of radiation. 22 treatments were to her entire brain and spine, and the remaining 8 were to the original tumor site in her brain. She also received the chemo drug, then Kristin, 6 times during the first part of her protocol. After a short 6-week break, 4 of those weeks were spent in the hospital, she continued with 6 additional rounds of high-dose chemo. She underwent a second tumor resection because after the first and all of that treatment, they still found a small amount of remaining residual tumor. That surgery was a complete success. The pathology reports were conclusive, and the remaining residual was dead, so there were no active cells. Madison still had to continue with oral chemo for 11 more months. She completed her treatment June 1st, 2008. So to have Madison alive is truly a miracle, and just I can't tell you how sick this girl was. She's one of the kids, one of the sickest I've ever seen. She had feeding tubes and was so frail. And so it really is a miracle that we celebrate that Madison is alive. But life is really not easy for her. I just want to give you a glimpse of what she deals with as a result of the treatment, all that treatment she received to save her young life. Because of the high number of blood transfusions Madison had throughout the course of her treatment, she recently was found to have 16 times too much iron in her blood. That caused severe fatigue and weight loss. So she had to have a phlebotomy every month for 9 months. And in that's where she went in. It takes 4 or 5 hours, and she went in and they drained 50 vials of blood from her every month. This could be a lifelong issue. They don't know yet whether her iron levels will creep back up or stay stable. She received cranial and spinal radiation back in 2007 at the age of 15, and her jaw took a hit with what's called radiation scatter. A few years ago, her bottom jaw began to slip backwards, and it fell so far back that she was only able to eat with her back molars. Her teeth began to show excessive wear, and so once she became strong enough and healthy enough, they had to go in and correct her jaw and bite. So in this past summer, she underwent extensive corrective jaw surgery where they had to saw the jaw on both sides. Her recovery has been very difficult, as you can imagine. The radiation, this is kind of a new thing. The radiation to the spine hit her esophagus, so she's had problems with choking. What they found was that she has scar tissue in her esophagus because of the radiation, so they have to go in and break up the scar tissue and probe and dilate her esophagus basically to prevent her from choking. She has to have 4 of these procedures done in the next 2 months. And this will also be a lifelong problem for her. She gets frequent infections in her eyes, nose, and ears. This summer she developed a condition, it has a name and I can't remember, it starts with an M, which is antibiotic resistance in her ears. She has severe hearing loss, so of course when she gets those ear infections she can't wear her hearing aids. So you see that picture with the beautiful hair? That's a wig. She doesn't have any hair, and she never will. She has had damage to her short-term memory. At age 21, she's computing numbers at the 4th and 5th grade level. She used to be in the gifted program, so this is very difficult for her, very frustrating. She knows that she used to be able to do it, and she can't do it now. It's very frustrating for her. She has early onset of cataracts, And she has balance issues. Her mom describes her walking as though she looks like she's intoxicated when she walks. So this is Madison's life at 21. I wonder what 31 will be like for her and what 41 will be like for her. Yet, when I talked to her mom yesterday, I just wanted to get permission to share her story with you and her pictures. Her mom said they were blessed. That's the word she used to describe them. They're blessed. She told me Madison often refers to her cancer as a gift. She said having brain cancer has forced Madison to face her own mortality. She's a survivor, and every day she wakes up and thanks God for her life. She appreciates nature, loves deeper, laughs harder, and tolerates differences. She doesn't sweat the small stuff. Everything to her is now the small stuff. Madison has learned, this is what her mother said, Madison has learned what so many people take a lifetime to learn. To appreciate all you have, to be grateful for those you love, and never ever take your health for granted. So I share Madison's story in addition to Carter's because Madison is the success story that we celebrate. It's the 80% survival that we celebrate and that people think causes people to think, oh, well, there's no real urgency. We're saving 80% of them. That's what we're doing, and as we save them. So, of course, we're thankful for her life. But what if there's a way to cure Madison and other children like her without leaving them in that condition? Cure is funding research right now, with your help, at MD Anderson, which hopefully one day will not only help cure kids like Madison, but will prevent all of these other horrible things. This project involves the testing of testing the therapeutic potential of what's called natural killer cells, which exist in all of our bodies. It's a collaborative trial, and it will be the first in the world to treat pediatric patients with brain tumors by administering the natural killer cells to the fourth ventricle of the brain, which is where this kind of cancer, medulloblastoma, most commonly occurs. So one of the doctors has developed a catheter specifically to inject these natural killer cells directly into the cancerous site. And the other doctor that he's working with has developed a procedure to extract the natural killer cells and expand them for reinsertion through the catheter. Their hope is this combination of therapies which is significantly less toxic than traditional chemotherapy and radiation, will not only increase patient survival, but will also improve the quality of life post-treatment. That's what your money is going to. That's the kind of thing you're funding. So I use those stories to give you real-life examples of what you're doing when you get out there and you raise money and you send it in to the Federation for Cure. We absolutely could not do what we do without you. We could not. We don't have groups like you who have given us $300,000 over the course of 10 years. That's just extraordinary. So I hope that you all feel so good about choosing to support Cure and choosing to get behind childhood cancer. It is a serious problem in our country, the leading cause of death due to disease in children, and we just really thank you. If any of you have any questions now or later, I am more than happy to answer them. So thank you.
We wonder what we do, why we do it. That's why we do it.